Thanks for covering the topic. It's super important.
Both Delegate Rodney Willett, who chairs the state's Joint Commission on Healthcare,
Well, it's unacceptable.
and Shawnfil Chambers, a mom whose NICU baby contracted the antibiotic-resistant infection MRSA while in Henrico Doctors Hospital in 2022, and who later learned through CBS 6's reporting that a MRSA outbreak circulated in that NICU for 3 years and infected 94 babies.
As a parent, my initial reaction is troubling for one.
Expressed concerns over numbers exclusively obtained by CBS 6 from the Virginia Department of Health, showing just how behind its Office of Licensure and Certification is on biennial hospital inspections required by state law.
Well, I mean, I appreciate the fact that VDH has struggled getting enough people to do inspections in a number of areas, as we've talked before about nursing homes. They've tried to bolster that program, but meanwhile, they're behind on the hospitals. And so I'm very concerned about that.
Now, according to VDH, as of August 7th, the OLC is overdue on 99% of hospital inspections and 95% of outpatient surgical hospital inspections. That's even worse than the previous August, when 99% of hospital inspections were overdue and 91% of outpatient surgical hospital inspections were overdue.
My message to the state is get it together, because the public depends on you to make sure that we're safe.
Inspectors look for a number of quality and safety measures during these state inspections. For example, they make sure hospitals do infection control in the nursery, establish a hospital-wide infection surveillance program, assign nursing personnel to patient care units in a manner that minimizes the risk of cross-infection and accidental contamination, and have procedures to sterilize and dispose of waste and contaminated supplies.
Do you think that doing these inspections provides a level of oversight and accountability for the hospitals?
I think it does.
Delegate Willett says VDH has struggled with recruiting inspectors, both to do nursing home inspections and hospital inspections.
It's not the easiest job. You've got to cover not just the large metropolitan areas of the state, the entire state. Hospitals go from one end of the state to the other, so you're talking about covering a lot of miles there. And then it's tedious work to go through these inspections and the things you have to do, the standards you have to make sure the hospitals are abiding by.
And he says VDH told him hospital complaint inspections are being addressed in a timely manner. But at the end of the day, he says VDH has got to get these biennial inspections done. And if the legislature can help VDH get them done, he is open to considering legislation or dollars.
And we can certainly, if we feel like something's not adequate, we can pass additional legislation. We also have the power of the purse, because we have multiple members of the Joint Commission who also sit on appropriations and Senate Finance. And we are coming up on a budget year.
We asked VDH why the vast majority of hospital inspections are overdue, and they sent us a statement that reads in part, "We have engaged in an aggressive recruitment initiative to fill every medical facility inspector opportunity so that we have a full team of experienced personnel to ensure that Virginians receive the best care possible when they enter any medical facility in the Commonwealth. Already, we are seeing a record number of applications for our current open positions. Yes, we have a backlog, but we also have a plan in action to eliminate and prevent its recurrence." I'm Melissa Hippolyte for CBS 6.